Thank you. First and foremost, I know Oklahomans are hurting. A lot of them are anxious and fearful of the future, but I want Oklahomans to know that we will get through this. I've been in constant contact with the president and his administration, and he's issued some new guidelines that I wanted Oklahomans to know how important it is that we follow here at home. This situation has been evolving rapidly, and as a result, the guidance from the president and the CDC regarding COVID-19 has changed significantly in the last 24 hours. These guidelines are the right steps at the right time. To stay proactive in rapidly changing environments, I am issuing an executive order today strongly recommending Oklahomans follow all the guidance from the CDC to protect public health over the next 15 days. The guidelines include avoid gatherings of more than 10 people, avoid discretionary travel, use drive-through, pickup, and delivery options so we can continue to support our local restaurants. Do not go inside nursing homes or our assisted living centers, but instead call or FaceTime your loved ones. Let me be very clear. If you have a cough, a fever, or shortness of breath, stay at home. If you believe you may have symptoms of COVID-19, stay home and please contact your health provider. It is critical that we do not flood the ERs if symptoms are early. Healthcare providers can conduct an appropriate screening and determine if you're a candidate for testing. We have set up a call center that's now manned 24/7. I want to give that number to Oklahomans. It's 877-215-8336. That number again is 877-215-8336. It's also important to remember that 80% of the people who get this virus will have mild symptoms. I have been in constant contact and holding meetings with the leadership of the state, our state agencies, our hospitals, healthcare professionals, business owners, trying to determine the most innovative solutions to not only protect our workforce and our hardworking Oklahomans, but also protect and mitigate this health issue. On Monday, our state agencies began implementing telework policies to limit face-to-face contact. This morning, I sent a majority of my staff home to work from home for the next 15 days. I'm encouraging Oklahoma businesses to also innovate and quickly mobilize to allow their workforce to work from home when possible, to limit professional gatherings. On Monday, I also spoke to the Restaurant Owners Association and a lot of restaurantees across the state. This is going to cause great upheaval for the hardworking Oklahomans, many of them who depend on these paychecks and are hourly workers. As governor, I urge Oklahomans to consider curbside pickup and delivery from your favorite restaurants. We need our job creators to get creative during these challenging times, and we must also critically balance protecting public health during this next 15 days. I also spoke to the Grocers Association. Many Oklahoma grocery stores have committed to reserving the first hour of business every single day for our elderly to shop. So if you're healthy, please wait until later in the day to buy your groceries. This will allow those who are vulnerable to shop right after the stores open, right after they've been deeply cleaned. Today, I'm also issuing a second executive order suspending many state regulations that could be barriers to quickly and proactively reduce the threat of COVID-19. I'm requiring all hospitals, medical clinics, and private testing labs to report accurate data to the state health department every single day regarding their capacity to take new patients, their equipment supplies, and their testing results. We've also cut regulations on telemedicine, making it much easier to see your doctor without leaving home. This order also allows healthcare professionals like doctors and nurses who are licensed in another state to get a temporary license to practice here in Oklahoma. I've also cut restrictions on truck drivers and commercial vehicles so they can effectively respond and transport medical supplies and other items. America's supply chain remains effective and intact. This is something that the President explicitly wanted me to remind Oklahomans, that there's no disruption in the supply chain. There's no need to stock up on anything. Our lives will look very differently for a little while, but Oklahomans have recovered from tough times before, and we are going to get through this. A great example of an innovative way to adjust to these unprecedented times is our very own Life Church, based right here in Oklahoma. Life Church invented a platform so churches can hold online services and has made it available for free to any church who wants it. 5,000 new churches have signed up this last week alone, and it's easy for even the smallest congregations to use. We are committed to making the right decisions based on the available data and be very transparent in all of our decision makings. We are actively expanding our capacity in our state agencies to deliver on that promise, and we are actively working with the federal government to increase our supply of COVID-19 test kits. Let me close with this. I know Oklahomans are fearful. I know Oklahomans are anxious. And when I feel that way, I have to turn to the scriptures. And so let me remind you of my favorite verse in this time. Philippians 4:6. Do not be anxious about anything, but in every situation, by prayer and supplication, with thanksgiving, present your request to God. And I know Oklahomans, we're going to get through this time together. And so I just now want to turn it over to Commissioner Cox to update you from his department. Thank you.
Thank you, Governor. Our top priority continues to be the health of the public of Oklahoma. And the State Health Department will continue taking measures to limit community spread and communicate the facts as we have them. Our primary concern is to protect the most vulnerable Oklahomans, and we're working to form public and private partnerships for enhanced capacity to ensure that we are providing adequate screening and testing to those who are the most vulnerable, such as those who have underlying health conditions, as well as our elderly population who do have underlying health conditions. It's a major focus of ours to ensure our hospitals remain prepared to respond as needed. What we're really working on and discussing with hospitals is the surge capacity of our hospital systems. And so we would encourage you to be aware of those who might need more critical care and access to our emergency rooms and urgent care centers. As we know, most of the cases of COVID-19, 80% or so, are mild cases and can be adequately treated. Almost all of those can be adequately treated at home. Public health and healthcare professionals are working at all levels to screen, educate, and refer Oklahomans to the most appropriate level of care to slow the spread of COVID-19 in our state. We're relying on these providers to screen and identify for testing. It's important to stay home if you're experiencing flu-like symptoms and call your healthcare provider for further guidance. They will determine the need for further testing. Please keep in mind that there is no treatment for COVID-19, so if you are tested and receive a positive result for COVID-19, the advice is exactly the same for anyone who might have flu-like symptoms, which is typical home care. For those with more serious conditions further care may be needed. The State Health Department is aggressively standing up within each of our 9 public health districts in Oklahoma additional screening resources at our local health departments. And as it becomes available, testing for access in each part of our state. Our city-county health department partners in Tulsa and Oklahoma City are also planning additional touch point screening and additional testing as it becomes available from our federal partners. We have 7 new cases, so our current total is 17 positive cases for COVID-19 in our state. So we all need to be aware that as we do expand our testing capability, we will find more cases and the caseload will grow. So to protect yourself as we go through the coming days and weeks, it's important to reiterate our governor's advice to be aware of the latest news coming out of our state and federal partners. Our rich network of public and private partners is working to provide the facts and the resources to you so that you can make the best decisions for you and for your families. The best way to protect yourself and your family is to pay attention to how you're feeling and be knowledgeable about what's going on in your community. The best way to stay up to date is to visit the Oklahoma dedicated COVID-19 website at coronavirus.health.ok.gov, as well as the CDC website. Our response goes far beyond the state health department. We're very appreciative of the other state agencies here in Oklahoma coming alongside us to work for you and prioritize the health of all Oklahomans. This is all hands on deck for us and for the state agencies, and in addition to their regular jobs day to day and their responsibilities, state employees from other agencies are pulling together to make a strengthened response. We encourage Oklahomans to do what's best, pull together, take care of each other, and we'll get through this by working together. We're all responders in this situation, and we have the opportunity to be informed and take responsibility by following the guidance to protect ourselves and to protect those who are most vulnerable in our communities and state.
Questions? Mr. Cox, could you talk about where you are today in testing? How many people can you test a day? Who's being turned away from testing? Who's being tested? And where do you hope to be a week from now?
This changes by the hour because we continue to get testing samples into our laboratory throughout the day, but around 350 total tests to date. And so we will continue to get those test results throughout the times of the end of the days of the week. Where we hope to be is we hope that the federal pipeline of supply of the materials that it takes to do these tests will become available very soon. We're told that that's what to expect, and so we hope that that's the case and we can expand testing to more people in Oklahoma that need it.
How many tests do you wish you had, like today? If you had an unlimited amount of tests, how many would you be doing today?
Well, I'd say enough tests so that we could test everybody that would be a prime candidate for testing, and primarily those are going to be folks that have the symptoms of a cough, of fever, of tightness in the chest, sore throats, things of that nature, and also focusing on the vulnerable, I'd say on the priority communities that we have, such as first responders, hospital workers, and hospital workers, and vulnerable populations. So those would be our target groups.
Why are we so low? Why are we so low? Why does the state only have 350, but these private testing?
I think we're going to get Lawrence to answer some of this.
Okay.
I have some comments, sorry, we jumped the
Okay.
gun. And I
Sure.
think his comments can answer some of those questions.
Lawrence.
Before additional questions, just want to stress to you that We know that we've had multiple cases confirmed of COVID-19 of individuals that have no travel history or contact with other individuals that have a history of illness. And what that means is that we have community spread in Oklahoma. This is something where we have individuals that have been infected, that have been confirmed, that do not have an obvious linkage to somebody else that may have had illness confirmed as having COVID-19. We've known that this is something that would be coming at some point in Oklahoma. It's certainly impacted several states. But of course, we're working to implement the appropriate control measures around those that are confirmed as having COVID-19, as well as working with our state and federal partners on mitigation efforts for the state. We encourage everyone to please remember to take the appropriate preventive measures to reduce the occurrence of continued spread to other individuals, especially taking that personal responsibility for your family members, your loved ones, and other members of the community, especially those that are more vulnerable, that may be at more risk of severe illness. So if you're sick, we really encourage you to stay at home when you're sick. In the time frame that you're recommended to stay home when you're sick, if you suspect that you may have COVID-19 based on the symptoms, is to stay home until you're at least 72 hours fever-free without the use of fever-reducing medication, and that's been at least 7 days from your onset of initial symptoms. That's a time frame that we know that you are likely to no longer be infectious and a risk to spreading to other individuals. And we also encourage you to remember to take those other personal precautions, such as hand hygiene, of course, utilizing soap and water on a regular basis or alcohol-based hand gels, being aware of those that are around you that may be symptomatic, working with us if we advise you to isolate when you're sick or to possibly limit your movement in quarantine if you're a known contact to a confirmed case. All these measures are going to be very beneficial for us to limiting the continued spread of COVID-19. Regarding testing, I want to stress that there's a couple of practices here. There's screening versus testing. With screening, a clinician asks you a series of questions to determine the severity of your symptoms, and if you need specific evaluation further within their clinician's office, or if they have to refer you to more urgent care such as an ED, versus if they can advise you that your symptoms are mild enough to where you can take care of yourself at home with plenty of rest, drinking fluids, and staying in touch with your healthcare provider as you monitor your symptoms and recover. For those individuals that may be at greater risk of severe illness, or they may be affiliated with more high-risk situations, such as long-term care facilities, or the individual that is sick is actually a perishing care provider, healthcare provider, then that may be prioritized for testing so we can confirm the occurrence of COVID-19 and ensure that we are implementing the appropriate control measures.
Governor, is an executive order aggressive enough to get people to stay home? I mean, no offense, people have been talking about social distancing for a week, and I haven't seen a big decrease in restaurant traffic. I mean, you were at a restaurant over the weekend.
Yeah, so this has really been rapidly changing over the last 24 hours. And so, as you know, the CDC went from 250 down to 50, down to 10. I believe they let that one out yesterday. So really it's changing very, very rapidly. This is the first time that we've stood up, and our guidance for the state is to limit the gatherings of 10 or more and really follow those guidance for the next 15 days. And I'm urging Oklahomans to follow that, and I think that will make a difference. And you have to balance between forcing private businesses to do things and public health and following the guidance. So that's why it is a balancing act to make sure that we mitigate this as best we can. We're listening to the advice of the CDC as it changes rapidly.
And at what point do you reach the point where you're like other governors in other states and just order everything closed or curfew or anything like that?
Yeah, so again, we're going to monitor as guidance changes from the CDC, from the administration, from our experts in the state. I know that other states have done that. Every state is a little bit differently on where they're at in this curve. We're really trying to flatten the curve to make sure that our hospitals and our healthcare providers don't get overloaded. So we were just on a call with them and really talking about what their plans are for additional beds if they needed to, and really trying to learn from some of these other states.
Has this changed your thinking on Medicaid expansion at all?
I'm sorry?
Has this changed your thinking on Medicaid expansion at all, and possibly they're still offering waivers down the line? Are you still committed to that?
Yeah, so Sooner Care 2.0, we've submitted our SPA plan to the federal government. We're waiting on that response. We'll do the waiver plan at a different date. We're still working through the legislature on the funding mechanism and how that works, but that's the right way to deliver health care for Oklahoma and make sure that we we take care of some of that uninsured population, and we're looking forward to getting that across the finish line.
So this virus thing hasn't caused any difference in that plan?
I'm sorry?
This virus hasn't caused any difference in that planning for that?
No.
A Senate staffer apparently turned up positive for COVID-19. What do you know about that? What does that mean for the legislative session? What does that mean for the restoration project?
I'll let one of these guys answer what the health department is doing to mitigate that, to screen the folks there, and they can kind of address that. I'm already working with the House, the Senate. The only thing constitutionally we have to do is pass a budget by May 31st, and so we're working together to get that fast track, get that earlier in the session. If we have to have an extended period of time, we want to get that finished for Oklahomans instead of having to come back in here for a special session. But you guys might address, whoever wants to, on mitigation of the affected person.
Can you also, while you're discussing the Senate, address why they are getting tested when other Oklahomans cannot get tested?
Okay. So regarding the investigation itself, the process for investigation is pretty straightforward. What we do for any other case investigation, which is once we have confirmation of a case, we immediately start interviewing that individual to identify those that are deemed as being close personal contacts. So individuals that would have been within 6 feet of that person for at least 10 minutes cumulative time. Those individuals that are identified as close personal contacts during the time that person could be infectious to others, those persons are advised to adhere to quarantine. So that means staying at home, limiting their movement in public spaces for the 14 days after their last exposure to the case. Other individuals that may just be casual contacts that may have been walking around the same area, just kind of casually walking by, brief conversations, they would not be at increased risk, so there would not be any kind of specific movement restrictions for those individuals. So that's the contact tracing part and the restrictions on movement. We also advise, of course, that when a case is identified in a specific institutional setting, that we recommend environmental disinfection and cleaning. Now, of course, this is not beyond any kind of more routine measures, but just making sure that there's a time utilized to take the EPA-approved products for disinfection and cleaning down especially frequently touched surfaces, so door handles, desktops, things that are frequently touched by individuals. Just that way we can reduce the potential for any kind of indirect transmission through fomite contamination. Now, regarding your point about testing, our recommendation, of course, is that the testing is going to be specific for individuals that may be experiencing symptoms of illness that are consistent with COVID-19. Now, if individuals are able to access testing through other means, our priority is that we advise those individuals specifically that have developed symptoms that have been in contact with another person.
So that you're saying they could go through a private lab and you would have no control over that?
Correct. We have our public health investigation and we have our recommendations, and we are certainly prioritizing our testing for specific at-risk groups. So the people that we are prioritizing testing, of course, will be those that we need to have a strong public health response. That would include those individuals that may be healthcare providers that are symptomatic, where they may have been exposed during their regular patient care practices, individuals that are severely ill, hospitalized, may need intensive care unit care. The reason why those individuals are prioritized for testing is because it helps with clinical management decision-making for providers that's involved with that person's care. And then suspected outbreaks. So individuals, when we have multiple people tied to an institutional setting, especially if we have individuals in a very high-risk setting like a long-term care facility, that's where we need to prioritize public health resources to ensure that we have quick response in regards to testing that can guide our investigation.
So these tests didn't use public health resources, they used private resources? They didn't dwindle our supply, the public supply? Tests?
Correct. We do not advise on testing through our public health laboratory, but we know there are reference laboratories that are out there. We would hope that those reference laboratories are able to fill the void and the concerns for individuals that want to be tested. Again, just want to stress that individuals that are mildly ill, persons that don't need to seek care, they have fever, cough, shortness of breath, but they can manage those symptoms at home with rest, drinking fluids, remaining isolated from their other family members and from those public spaces. Those individuals, if they contact a physician, they may just be advised to stay home, follow those instructions from the provider over the phone, and remain in touch with them if they have concerning symptoms that develop. So over the next several days, you're caring for yourself. If your fever continues to increase at a very high level, or your shortness of breath worsens, or chest tightness, then it may be advised to contact them again or seek further evaluation. But in general, most individuals will be able to remain at home in isolation and care for themselves.
Can you address surge capacity in hospitals? Do you know, like say in Oklahoma City in the metro area, how many COVID-19 patients they could take, like all the hospitals at once could take if it really got, like say as bad as Italy or something?
Sure. So there is information that we obtain. We conduct surveys periodically from our hospital partners. I don't have the number specifically off the top of my head. I apologize for that. But we are asking them about ICU bed availability as well as their ventilator inventory and capacity. So that way we can help them with surge capacity as needed. We also want to stress that hospitals have emergency response plans that are in place to where if they have to make critical decisions in regards to maybe modifying the types of procedures or surgeries that they are offering, such as elective procedures, to maximize the use for more critical care, that is something that hospitals have plans in place. And then we are in communication with them on their supply needs so we can direct the appropriate resources when available to assist them in regards to personal protective equipment or other healthcare resource needs.
I have a question for Governor Stitt, if I could. This is Russell Mills at KRNG Radio.
There's a call here, sorry.
This guy keeps trying to get a call in. Hey, go ahead. We can barely hear you.
Okay, sorry. This is Russell at KRNG Radio in Tulsa. I'll turn my mic up a little bit. I have a question. Yesterday, your office told me that the Oklahoma Medical Reserve Corps has been deployed to 32 counties in the state. I'm curious, how were those 32 counties chosen? What about the other 45? And are there any plans? Is that a National Guard unit? Are there any plans to call out, National Guards just to erect extra hospital beds if we find ourselves in the position of needing them?
Go ahead. I'll take the National Guard, please.
Well, yes. Well, you want to address the National Guard?
Yeah. So on the National Guard piece, that's definitely that's a lever that we can pull. I've had my administration reach out to General Thompson and his team. They're there in the back just to make preparations, and in case we get to a point that we need to call them up to create more ICU beds, then they're working up a plan for that, so we can pull that lever if and when we need to pull it. Regarding the 32 counties, I'll let you address that.
Thank you. We do have a Medical Reserve Corps, and this is a group of volunteers. Some of them are medical and some of them are non-medical. And so it's possible that we can always call them up as volunteers to help out in this effort. And so they can do many things. For example, if a mobile tent adjacent to a hospital needs to be put up, or if they need to staff additional resources, then they're always a resource in a public health situation.
Thank you.
Miss paycheck, they might have their utilities cut off or be evicted, become homeless. Are you guys looking into maybe stopping that, or?
That's the thing that keeps you up at night is the Oklahoma workers, how this is affecting them, how it's affecting our healthcare providers. Our schools are canceled for 2 weeks after spring break. I know that's something that the federal administration is also looking at, what type of efforts that they can do, because this is affecting workers across the country. So our administration is looking at all those kind of things. I know there's levers that we can pull to help some of our small businesses. One of the reasons we signed the emergency declaration was to give our small business access to some federal dollars and some low interest loans. So I know we got that available for them as well on Sunday night. So we're seeing those folks start to request some assistance.
Emergency Management Director Mark Allen's here. I'm going to have him give you some additional information on that. Go ahead, go.
Thank you. We've been working under the direction of the governor to make sure that we have all of the support for anyone that might be impacted and how that they can be isolated or quarantined and continue their lives without interruption. So we've been working with our utility companies, and every one of our utility companies have come through with a plan to make sure that our Oklahomans can stay within their homes and still receive services from those. And we have stood up some support around them, so as if they need that support, we can bring local support to them on supplies and the things that will keep them sufficient where they're at so that we can get through this and then they won't have to interact with the public.
Governor, along those lines, I think now the Central Office of Plan to ease requirements for unemployment for those who might be temporarily unemployed because of the virus. Have you had a chance to look at that, or do you have a plan of your own?
No, that's something that we'll look at. Our unemployment department will be really quick to make sure that those payments are made quickly to the people affected. We've heard, some restaurants are laying off, and so we'll get on that, and we'll make sure we do whatever we have to do from a state level to suspend some kind of, if there's any red tape that's keeping that from happening quickly.
The biggest thing that we're seeing is Oklahomans are worried that we're not going to be able to keep up with this. So why does the state, I just want to make it very clear, why does the state only have 350, but yet these private outside sources have so many? Are we going to be able to keep up? Because right now people don't know where to go. Can we just make that clear? Because that's the biggest question that we are seeing.
Sure. Well, we order the maximum amount of test kits at every opportunity, every day. And so it's really a matter of supply chain, and it's a matter of private manufacturers ramping up that supply chain for the mediums that it takes in order to run those test kits for the reagents and things of that nature. There's been a lag, I guess, in the manufacture of those things that are necessary to do the test. We are assured that the federal supply chain has been working around the clock to meet this need, and that private labs and then access for our public lab as well should get some relief. We don't have an exact date of that, but sooner rather than later.
The legislature's taken some action today to try to offer some flexibility for public bodies at the state, county, local level to be able to meet with teleconferencing and other technology. Can you speak to the need to do that, the goal, and then also what your recommendation personally would be to public bodies who have to deploy that? How do they maintain transparency in how they conduct business?
Yeah, so I believe it's passed the House, maybe it's waiting to be passed in the Senate, but basically suspending some public gatherings to allow teleconferencing to hold meetings where people don't have to get together all in person. So we're going to suspend that for about 6 months. The purpose is just so we can continue to function. The House is considering doing a vote by proxy to make sure that if they have to pull that lever, we can vote and get the people's business done here. So the purpose is just to continue to business without having to congregate, and we're wanting to do that at least for the next 6 months until we get past this.
Do you have a little advice to local city councils and school boards and entities that may have to do this in the next 6 months? I assume it's still valuable that they are transparent and try to, make sure the public knows what they're doing.
Yeah, I don't think we're waiving any of the public notice or, we can record those meetings, invite press to those meetings. So it's not trying to not make all those meetings public or the discussions public. The deal is just to make sure that people have access to continue to conduct business remotely and without having to get into big groups. So that would be our recommendation. As long as the CDC is saying, hey, we need to keep these gatherings under 10, then that's what my recommendation is for Oklahoma, so we can mitigate this and really flatten this curve for the next 15 days. And that's our recommendation at this point.
According to the Oklahoma State Department of Health, Senate President Pro Tem Greg Treat said in a statement the risk.
Go ahead.
Sorry about that. Governor Holt announced today that bars, gyms, theaters, some restaurant services will be closed. Is that the appropriate action?
Again, every mayor is going to have to make a decision for their communities, and what's in Oklahoma City is different than in Guymon or in Lawton. The state's recommendation is let's support our local restaurants. Let's do curbside. Let's do delivery. Let's innovate. But I'm going to let the mayors obviously are making decisions of what's best for their community, and I'm going to stick with what the CDC is recommending, and it's guidance that we limit gatherings of 10 or more. That's what it says, and that's my recommendation for the citizens of the state of Oklahoma.
Let's take that question from the phone.
Yep. Go ahead on the phone. You had a question?
Governor Stitt?
Yes.
Yes, Governor Stitt, it's Tiffany Alaniz from Fox 23 in Tulsa. Thank you all for taking our questions today. Quick question for you regarding the Senate. So I want to make sure I understood Gary Cox correctly. Is he saying that only senators or anybody that they believe was impacted with symptoms or in the high risk category were tested and not all senators, or what is the exact answer on that? And then also, Governor, just for you, wanting to ask healthy Oklahomans who are wanting to see what they can do to help during our state's time of crisis, what can they do to help? I know a lot of people have offered to go get groceries for elderly neighbors and that type of thing, and then obviously with the schools being out, getting kids fed. What is the advice for Oklahomans who are healthy and not in the high-risk groups to help out during this crisis?
Well, you said it very well. I mean, with our kids being out of school for the next 2 weeks after spring break, getting some of those kids fed is going to be really, really important. The USDA lifted some of their requirements, so we're gonna still have some cafeteria workers there feeding the kids, but volunteering, helping with that. Our hospitals may need some help as well. You can go to my Be a Neighbor website that we've rolled out, and we've got a couple different things where you can be a neighbor and help. And then I'll let Laurence answer how many of the senators were tested, and I think most of them were the private lab tests. But Laurence, I'll let you answer that.
So correct. If I remember correctly, approximately 30 individuals decided to pursue testing. Again, that was not testing that's being done through our public health laboratory. Standard for investigation is that, of course, individuals that are symptomatic, those are the individuals that may be tested, of course, because we need to determine if their illness is actually due to novel coronavirus. When it comes to contact tracing, normally we do not have to pursue testing for individuals that are currently not experiencing symptoms. Those individuals normally would just have to watch for any symptoms developing within the 14 days after their last exposure. And then we would obviously put in specific control measures such as restricting their movement, advising on quarantine. If very high risk, we may be enforcing that quarantine if necessary. But sometimes individuals may decide to pursue screening themselves. But that's not something that's being done through the public health laboratory.
Take one more here.
Can you tell us what the staffer's role was here? Obviously, if it's in LA, they've got much more contact with the community than, say, Paige does. What was the staffer's role here in the Capitol? How many people potentially could they have been in contact?
So to assure that we actually maintain the confidentiality of the individual, we have to limit the information that we put out publicly about that individual. However, we want to ensure that that does not restrict our investigation. So if we're able to identify specific individuals that may have had close personal contact based on their role, whatever setting it is, then we're able to go ahead and discreetly identify those exposed contacts and work with them to put in those appropriate control measures as described, such as monitoring their symptoms and restricting of movement. If there is a concern where there's a situation where we may not know everybody that would have been exposed, that is a situation where we may have to go out to public advisories to advise the general public about a specific place where a person may have been, and to advise them of also watching them for symptoms and how to reach us if we needed to do that. So there's always a balance of assuring that we maintain a person's confidentiality, but that we're providing enough information to help aid us in our investigation.
Can we just get one more from the governor about President Trump saying yesterday that Oklahoma doesn't have a tremendous problem? Can we just get your response to that when a reporter asked about your tweet?
Yeah, I mean, the president said Oklahoma didn't have a tremendous problem. I don't think he's up to date on every single case in our state. The good news is we're ahead of the curve, and I was excited that he said that, and we're making appropriate moves to mitigate the spread here in our state. Our team's doing a great job. Oklahomans are doing a great job of taking this seriously, and we're following the guidance from the CDC. And for the next 15 days, that's why I held this press conference. I really want Oklahomans to know and limit their exposure to the groups of 10 or more, and all non-essential travel, et cetera, that we rolled out in our executive order. But we will get through this. I want Oklahomans to know to remain calm, and I know it can be an anxious, fearful time, but we will get through this. And I'm confident that when we work together and we're respectful to what our experts are telling us to do, that we're going to be able to mitigate this. And so I was excited that the president did say that we are ahead of the curve. So thank you all so much for joining us.